Every time an insurance company calls me about a patient, they're telling me not to do something that I know is best for my patient.
There's a lot of inappropriate care that goes on, and so that's what insurers are trying to basically regulate.
Insurance companies are making more and more money.
There is a business, and it's a very costly business.
I don't want to work in a system that requires heroic effort to get to the appropriate outcome. Okay, here we go. Do insurance companies prioritize profit over patient care?
The insurance companies are making tens of billions of dollars every year denying you coverage.
It was like the insurance company telling me my life didn't matter.
Breaking news, the CEO of UnitedHealthcare was shot and killed.
41% of people aged 18 to 29 think the killing was either somewhat or completely acceptable.
Quote, sorry, my sympathy is out of network.
This incident and the reaction to it ought to be a wake-up call to this industry.
Do insurance companies prioritize profit over patient care? I would say no. I think most insurance companies would believe that patient care is very important and optimal patient care is what they're trying to help deliver, and that there are not going to be any profits if they don't take care of the patient. So I would say no, they do not.
Got it. I would say that yes, they do prioritize profit over patient care. And I don't think there's anything wrong with making money in healthcare. When I think about finding the right point of balance, there's been a shift towards profit and away from this autonomous decision-making for patients. I can think of some specific examples where I know what's right for my patient, and I don't even think it's more expensive. But an insurance company has told me, no, you can't do that thing. You can't do that type of breast reconstruction. And in most of those situations, it's really felt like that was about profit. When I look at what's happened over the last 13 years that I've been in practice, insurance companies are making more and more money, and doctors are making less and less. And I see patients experiencing difficulties in getting care.
Well, a lot of responses to that. One is that there is a huge increase in healthcare costs.
American healthcare costs are by far the highest in the world.
We spend 2 or 3 times what other countries do.
The number one reason why most Americans file bankruptcy is because of medical debt.
And the insurance companies are basically hired to try to reduce those costs or try to keep those costs somewhat under control. And insofar as they do that, they're trying to make sure that the people who are insured are getting all the care that they need, but no unnecessary care. And most of the drivers in the healthcare system, from an economic point of view, are drivers in the direction of doing more, spending more. That's the way people make money. You earn your living by basically sort of doing procedures. So you're going to plan to do sort of more procedures. And that's not to say that the procedures that you're doing are sort of inappropriate, but at the margin, there's a lot of inappropriate care that goes on. And so that's what insurers are trying to basically regulate. But nobody really likes to talk about that much. Insurance companies don't like to talk about it because they don't want to be seen as the people who are sort of denying care.
You know, I don't think that that insurance companies should be in the position of policing bad doctors. Like, I don't actually believe that there's that many bad actors out there in medicine. If insurance is there to kind of control cost, you know, when you look at it, one of the biggest waste sectors is the administrative burden in insurance.
The cost of administration is enormous to our healthcare system.
More than $260 billion are wasted on administrative complexity every year.
Insurance companies aren't making healthcare any cheaper, and they say that they're protecting the public from, you know, fraud and abuse. I just, you know, I don't know that the majority of fraud and abuse in healthcare is on the side of doctors.
The biggest problem with our healthcare system is?
Oh, the biggest problem. Lack of transparency. If we could only just really see the cost in real time, if we were able to budget our healthcare dollar with transparency, like Americans budget their dollar when they, buy groceries. I feel like that would be a huge step forward. The fact that things are so obscured, that it's not clear how to get an insurance plan, how to get a contract if you're a physician, how much the procedure is going to cost, what is the rebate going to be on that medication. If we just had real-time market dynamics with transparency, I think we would have a healthier system. I wish that I could explain to you how healthcare pricing is set, but the truth is that it's all obscured.
The price for the same procedure at the same hospital, it varies enormously.
The same simple blood test, $19 over here, $522 just a few blocks away.
There just isn't transparency.
Doctors don't even know what's happening with our billing processes.
You go out to eat at a restaurant, the price of food is right there on the menu. Why is it that when it comes to many medical procedures, we only find out the price afterward?
I have started my own ambulatory surgery center, and I can see the costs there. Now I also see, because I can see the pricing, that the hospital has been overcharging 4 or 5 times what it's costing me to do these surgeries in an outpatient setting.
Well, I think that's a very good point. And certainly we have a non-transparent system, and there are steps being taken to try to make that more transparent.
We will have maximum price transparency, and costs will come down incredibly.
When you can see the cost of care before you receive it, you can shop for the lowest cost, highest quality treatments, which will drive down the cost of care by promoting market competition in the process.
Laws that have been passed and further proposals in Congress are bringing that about slowly, and I agree with that transparency is a real issue. From my point of view, the big problem with our healthcare system is access. There are just too many people who don't have access to good healthcare, and we continue to have a system that's very expensive and getting more expensive. Access, in many ways, was improving over the course of the last 15 years and now is taking a reverse turn, and there's going to be more people who are uninsured.
Lawmakers made deep cuts to safety net programs, including Medicaid.
12 million Americans are expected to lose health insurance.
Access to care we're at a crisis point in America. When patients are paying 10% of their take-home paycheck for an insurance premium and then being diagnosed with breast cancer and coming to see me and finding that, you don't have an insurance product that has adequate facilities or doctors in network, and that the premiums are so high or your copays are so high that you can't afford that care, it's getting harder and harder to get care through insurance. Insurance companies should have a say in what treatments patients receive.
I think that most doctors would disagree with that, but let me try to make the case why they should have a say. If you think about it, there's a big group of people, maybe it's a big group of employees, maybe it's us as citizens, maybe it's us as the entire country. We've all sort of thrown in together to provide a certain amount of money that's being put aside, and then that's going to cover the care for those of us who get sick. That community, since we've all put our money off together for this insurance policy, that community really wants that money to be spent wisely. Research over the course of many years has outlined that there's unnecessary care that occurs. And we as a community wouldn't want to have the money go to that. So the insurance company gets the responsibility of policing that, of taking the steps to make sure that the care is appropriate. So things like prior authorization.
Prior authorization.
Prior authorization.
Prior authorization.
You and your doctor have selected a new medicine to treat your condition. But before you can fill your prescription, you may need your health plan's approval. It's a process known as prior authorization.
That's interfering with the relationship between the doctor and the patient because they've already decided that they want to proceed with this particular procedure. But the insurance company's coming in from the outside to say, does that fit the evidence? And they're doing that, it feels like the insurance company, but it's basically not the insurance company. It's basically the community of people who put all this money in together to provide care for people who are sick and who want to make sure that the care is being rendered appropriately and with the best medical evidence. So that's the way the insurance company would see it.
I hear ya. I think they would see it that way. I think I see it very differently. I think insurance is so important, first of all. I mean, as someone who does breast reconstruction, everything that I do is provided for under the Women's Health and Cancer Rights Act, which says that insurance covers your breast reconstruction if you have a mastectomy. That's covered by insurance. So that has been life-changing for women affected by breast cancer. So I agree. I think insurance can be a really great thing. And I think insurance is initially thought of, where you have communities of farmers who put their money in a bucket and say, if one of us gets harmed, if one of us needs help, we're all there for each other, and we're going to draw out of that bucket. That is a beautiful ideal. It's not what we have in American insurance today. Every time an insurance company calls me about a patient, they're telling me not to do something that I know is best for my patient. Mm-hmm. I wish that when I, for instance, had a peer-to-peer call. Hello, this is Dr. Elisabeth Potter. Who is this? Hey, this is Dr. Potter. So you're calling to ask me for reasons why she stayed in the hospital beyond the first day? I wish that call was with somebody who was qualified to talk to me about breast reconstruction. Mm-hmm. But it's so often someone who's never done that type of surgery.
I did a peer-to-peer. That means I call the insurance company, then they transfer me to a physician. Now this is supposed to be a peer, someone that kind of understands sports medicine. Well, they put me in touch with a physician who's an internal medicine physician.
The doctor who called me was not a surgeon, and I actually asked the doctor, do you know what a DIEP flap is? And the doctor said no.
This is called a peer-to-peer, but you're not a surgeon. You've never done a shoulder replacement. How are you the designated peer from the insurance company who literally has the decision to dictate whether this patient's care is going to be approved or not?
The ideal I agree with, but in practice, I think that trust needs to be built back by the insurance company.
Mm-hmm. Yeah, difficult to do, I think.
Yeah.
There are going to be these conflicts. And that person who you're talking to on that peer-to-peer call, when there's a prior authorization for a procedure you're doing, they should have consulted the literature pretty carefully, and they should be ready and able to sort of talk with you about what your planned course is. And, there are rules and there are laws that oversee much of what goes on in prior authorization. And they have to adhere to those things. So it's unfortunate that your experience is that you're not seeing a lot of that. But from the other side, I can tell you that most of the people who are doing those peer-to-peer discussions feel like they're productive, and it's just somebody who's basically sort of dug in on what they want to do as opposed to what the medical literature might say is the appropriate thing to do. I don't see sort of how to ameliorate that situation well. I can take it to an empirical level and sort of say to somebody who's buying the insurance, like a big company, you tell them we're willing to take away prior authorization, but it'll cost 5 to 8% more in terms of what your total cost for insuring your employees are. They usually are going to say, let's keep prior authorization in place. In some ways, you can break it down into a set of sort of marketplace decisions, and most people are opting, in fact, universally opting to keep prior authorization in place.
It keeps coming back to money. As a physician, I just land on the side of, okay, it may cost too much. You, insurance company, that's your business to sort that out. Mm-hmm. I have to go to sleep at night knowing that I try to do the very best thing for my patient. Mm-hmm. If it costs that much, maybe you need a system that costs less.
Well, I mean, I think you hit the crux of the matter, which is really that there is a business, and it's a very costly business, and it's a business that more and more people are finding that they can't sort of afford, and that's not a good thing. You would agree with that. And that comes up hard against your desire to do what you think is right for your patient, and sometimes sort of coming into conflict with those who are trying to sort of police what the costs are. I'm a physician. I was a professor of medicine and law and public health at the Harvard School of Public Health and the Harvard Medical School for about half my career. And I was convinced that the healthcare system was not doing well simply because it costs too much.
What is really going on with healthcare costs?
Insurance companies are asking for big premium increases.
In my particular case, our premiums went up over 30% this year. How is that justifiable?
And I felt like the only entities in healthcare that had responsibility for oversight of costs were the insurance companies. And so I made a big career switch in the middle of my career to go over and work on the insurance side, simply to attempt to address this problem surrounding the cost of healthcare. And I loved being in the hospital, and I loved taking care of patients. So it was a big decision to decide to move over to the insurance side. And many people who I work with saw it as going over to the dark side, but I had great hopes for the kind of good that we might be able to do. A moment in my career when I had to make a decision that challenged my morals and ethics was...
Oof.
I'm going to do that one first.
Oh, heavens. Well, I had one this year, I guess the one that sticks out in my mind quite a lot. I was called while I was in the operating room performing breast reconstruction by an insurance company. They didn't know the patient's diagnosis. They didn't know she had breast cancer. They wanted me to justify her overnight stay. This has become absurd. I chose to speak out. I posted a video that I didn't think would be widely viewed. It was.
I got a phone call into the operating room saying that UnitedHealthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. It's 2025 and insurance just keeps getting worse.
Dr. Elisabeth Potter made national news for publicly calling out health insurance companies.
Video has now been viewed over 13 million times.
Millions of people got a front row seat to the bureaucratic madness doctors wrestle with every day.
This is exactly what is wrong with insurance companies.
And the insurance company kind of came after me for that.
United sought to discredit her and is denying coverage for her surgery center.
UnitedHealthcare demanded she remove the video from her social media channels, accusing her of making false claims.
And that it informed Dr. Potter that it wasn't accepting new surgery centers well before she posted any videos.
That was one of those moments in my career as a physician when I thought, to take care of these women, I can't just be silent. And it almost cost me my business. Being honest about the problems that I see for my patients, and being outspoken about that. That was a difficult decision this year, but also a rewarding one, like the hard things usually are.
I would say that in the area of sort of the insurance companies stepping in to sort of stop care, the really hard cases over the years I worked at CVS Health, I would see those. But in most of the circumstances, the really hard cases, we end up erring on the side of the patient and the doctor and sort of going forward with them. I would say that from a moral point of view, sort of the biggest issue for me over years was when I went to work for CVS, we had a big retail pharmacy, and it was all supposed to be sort of part of healthcare. But we sold a lot of cigarettes. And how can you continue to sort of sell cigarettes and consider yourself a healthcare company? And I thought I'd be able to sort of insist that we get rid of the cigarettes when I first joined the company. And of course, that didn't turn out to be the case. So my dilemma over the years was, am I really going to eventually accomplish anything here? And how much longer do I sort of struggle with it? So over the years, we continued to sort of build the case for getting rid of the cigarettes, and eventually we were able to remove them.
CVS will stop selling all tobacco products.
It will lose about $2 billion annually. But in making the decision, the company said, we've come to the conclusion that cigarettes have no place in a setting where health care is being delivered.
It does give, I think, a nice contrast to the perspectives that we have. When I'm working in an insurance company, I'm thinking of a big group of people. When you're taking care of patients, you're thinking about that patient right in front of you.
When I'm taking care of the patient in front of me, I'm thinking about all of the patients who are in that same situation. And I'm speaking here for all of the doctors who've reached out and who want to be heard. Okay. Doctors perform unnecessary procedures because there is a financial incentive to do so.
I don't think there's any doctors who tell a patient that they should have a procedure who are thinking to themselves, I know this is inappropriate, but I really would like to earn, $500, $1,000, $1,500 by doing it. So I'm going to go ahead and recommend it. On the other hand, and I know you've been in practice for a long time, but I've been around this healthcare system for 40 or 50 years now. And all the literature, including research that we've done ourselves, would suggest that, there are multiple motivations why people do things, but there's always an economic motivation as part of that. And at the margin, you can usually predict what's going to happen by looking at what the economic incentives are. And I hate to bring sort of harsh kind of capitalist market-based concepts into a discussion about patient care, but nonetheless, they're there. Our system is a fee-for-service system.
Fee-for-service.
Fee-for-service.
Fee-for-service. Doctor says, I did the following things to the patient, and the doctor then sends that bill to the insurer, and the insurer pays it. There's an incentive for the doctor to do more things to the patient than necessary.
The more patients you can get through the hospital, in and out of the operating rooms with efficiency, the profit is higher.
People make more money by doing more things, and so more things happen. I don't want to say that doctors do things inappropriately just to earn money, but I do want to say that there are financial incentives that are driving behavior. So I hope that that's a reasonable distinction.
Yeah, I think it is. I think that we don't have nationalized healthcare. We don't have socialized medicine. We have a business of healthcare in America. So of course, incentives can influence anyone to do things. But do I think that physicians on the whole make decisions based on finances, like treatment decisions? No, I do not. And I think that, my medical license is on the line there. So I will say that if you're going to trust an entity, I would rather put the treatment decision in the hands of the doctor who has taken the oath to care for the patient rather than the company who has a fiduciary responsibility to shareholders to maximize profits.
I agree with you completely. And that's why for years I've sort of preferred an approach where we use value-based or managed care.
Value-based care.
Value-based payments. Instead of reimbursing physicians for each individual service they render, value-based care ties reimbursement to the quality and effectiveness of the care provided.
We basically take a certain amount of money for each patient and assign that to a primary care doctor and the patient, and then the primary care doctor is responsible for making sure the patient gets all the care that's necessary. When that patient needs breast surgery, for example, that's a discussion between you and the primary care doctor. Now, that's a sort of fabulous world that we're never really going to have, but I would much rather leave those kinds of decisions about what's necessary in the hands of the doctors. And I think a value-based approach as opposed to a fee-for-service approach brings the appropriate incentives to do that. There are two options available for surgery. One option costs $10,000 and is adequate. Option 2 costs $30,000 and is far superior. Which one should an insurance company cover?
I love this. So immediately my mind goes to, what's our time horizon? Who's thinking about the lifetime of the patient? So for instance, implant-based reconstruction in the setting of radiation for women who have breast cancer, super high complication rate, super high failure rate. In fact, Medicare spends more money on implant rework than they do on natural tissue reconstruction. Natural tissue reconstruction is a really high upfront cost, right? But very high satisfaction and longevity, and fewer complications long-term, cost less long-term. So which thing should the patient have? Number one, I think it should be the patient choice. I think that if a patient wants, in consultation with their physician to have a certain type of surgery, that it should be not about the money, but about the outcome that they decide is best. But if there are two truly similar options, but one is more expensive and has a better outcome, I think that what we're seeing is sometimes insurance companies seem to be making decisions that are kind of short-sighted, that think of the patient only in like the term of their policy. As a physician, when I'm talking to a patient, I'm thinking about how they are going to live with this surgery for the rest of their life. And so I would invest in the surgery that has the better outcome long term.
That's interesting you say that. I think the question is this was like, you got something that's adequate, then you got something that's far superior that's more expensive. And the history of the American healthcare system is that if it's far superior, we redefine the standard of care. And then that standard of care is what has to be adhered to. So the insurance company is really not stepping in to define the standard of care. The standard of care is really defined by the physicians themselves and by the medical establishment. So in many ways, I think that the harder question is really the one you raised at the end, which is, sort of how long does the insurance company really care about these things? And that's one bad thing about our system of insurance in this country is that a lot of it's based on employment. And that might have been appropriate when that first began to occur back in the 1940s and 1950s when people stayed with the same employer for 15 years. But now people your age, for example, they spend a little less than 2 years with any sort of one employer. So no one has the sort of long game in hand. But having sort of said that, the insurance company is nonetheless basically structured upon the standard of care. And if the standard of care is that this particular procedure is superior, that's one that they're going to have to pay for.
Yeah, I think in practice, though, I see insurance companies telling me to do inferior surgeries. So, for instance, a patient had breast cancer on one breast and had advice from her breast surgeon to have bilateral mastectomies, and that was well supported in the literature as a risk-reducing surgery. And her policy did not support having a contralateral mastectomy. We really had to fight to get this insurance company to live up to the standard. But the insurance company said, we simply don't cover contralateral mastectomies. I do see insurance companies in practicality. I see them telling me what surgeries I can and can't do.
That's unfortunate. I hope it's not an insurance company I worked for. But be that as it may, most of the major insurance companies have very sort of clearly stated clinical practice bulletins about sort of what's acceptable care and what's not going to be paid for. That's meant to be very adherent to what is the existing sort of standard of care. So if you went to the American Society of Plastic Surgeons and asked them what the standard of care is, that standard of care should be part of what you find when you read the clinical policy bulletins that the insurers have. So that's a bad case that you're talking about. But I would say for most insurance companies, it's not going to pay for them to have a clinical policy that's outside of the standard of care because those cases would all be overturned and you just have wasted administrative costs.
They're not always overturned, though, because so many denials aren't appealed. Applying resistance to the patient and the physician often does result in that treatment not happening. You're talking about women who are at their lowest moment. They have no energy. I'm the only person, I'm meeting them and I'm saying, they've denied it, but I'm going to do my best. And I'm going to spend literally a year trying to get this done. There's so much wrong with that. I don't want to work in a system that requires heroic effort to get to the appropriate outcome. I want to work in a system that is so well designed and so intent on doing the right thing for the patient that it's easy to do the right thing, not hard. So this process of iterative appeals and conversations, it's so cumbersome. And it's one of the things that's driving physicians out of medicine.
Growing problem of doctor burnout.
Many contributing factors to doctor burnout, but a big one is the prior authorization requirement of many insurance plans.
Yeah, it highlights a real point of pain in the system now.
Yeah, I agree with you about that. There's tremendous sort of pain in the system. But I wanted to go back to what you said. With your patients, I'm presuming that if you feel like it's necessary, you do go ahead and make every effort to try to get that done. You actually go ahead and appeal and go through the prior authorization process.
We do all of it. And it is, I employ 2 people full-time doing that.
Generally I'm here to sort of support what it is insurance companies do, but they don't take into account your costs on your side of putting together the materials that are necessary to get the prior authorization done. And at least in this day and age, one would hope that much, much more of that could be done, through a digital electronic process than to have 2 people who are basically sort of pulling records and going back and forth.
Thank you. The best way to get healthcare costs under control is... Good one.
At least from my point of view, the only real way to get healthcare costs under control is for the government to basically sort of name what the rates of payment are going to be. I don't see much of a future for what's called commercial insurance, simply because I think the costs are rising fast and are going to continue to rise. To put it in perspective, today in most hospitals, a commercial insurance company will pay 3 times as much as Medicare pays and maybe 4 to 5 times as much as Medicaid pays for the same procedure. And so I believe that, eventually the government will have to name what those prices are going to be in order to get the costs under control.
I think that the best way to control costs in healthcare right now would be more competition. Mm-hmm. We have seen the near decimation of the independent provider. Mm-hmm. So previously, 75% of physicians were independent, and now 75% are employed. Mm-hmm. It's becoming so difficult for the small practices to exist and to compete with the larger consolidated practices.
Well, the insurance industry is consolidated, so the healthcare industry has to consolidate so they can compete with them. Basically, this ends up driving up prices.
When there's less competition in a marketplace, prices go up.
We need to create a culture of healthy competition in healthcare. Mm-hmm. And that's very American of me, mm-hmm. right? Competition brings out the very best in me. Mm-hmm. And I think that doctors know best what their patients need. Mm-hmm. And if you simply allow for doctors to do things like I've tried to do, to build a surgery center, to have a small business that mm-hmm. thrives on their main street. Mm-hmm. Right now we have what looks like a monopoly. Mm-hmm. And I would love, instead of going to the government being in control, mm-hmm. and Medicare there are lots of problems with that system, I would rather see more independent providers so that the consumer, the patient, can shop more.
I think those are both good and appropriate sentiments, but just take a different point of view. The reason why there aren't as many independent practitioners anymore is because if you join a hospital, you can get paid more because the hospital has a certain amount of market power, and as a result of that, negotiates for better rates for the physicians. The hospitals realized that as they got bigger, they were able to exert leverage vis-a-vis the insurers. And today, in most metropolitan areas, you have a lot of concentration of the insurers, but you have much more concentration of the large hospitals. And that's why the hospital rates have increased so much more dramatically than have the rates that are paid by government. So those market incentives are basically what's sort of sweeping up the individual sort of private practitioner. So there is something that's very attractive about the situation you have where you're an independent person, you've got consumers choosing to sort of come to you and you're providing sort of good service for them, and you don't want to have a boss from the outside telling you sort of what to do. And that's admirable, and in many ways it's very American. But the sort of sweeping forces of the market in healthcare over the course of the last 30 or 40 years are just sort of blowing that away. So I don't see it going back to an era where we've got a lot of private practitioners and choice by consumers. But I could be wrong.
Yeah, I hope you're wrong. And I think it has to go back.
The Affordable Care Act was beneficial to the health of Americans.
Absolutely. No doubt about it.
We are done.
Pre-existing conditions. I mean, yeah, definitely beneficial.
Tens of thousands of uninsured Americans with pre-existing conditions will finally be able to purchase the coverage they need.
I mean, more access to for more people. I'm a huge fan.
Today, almost 50 million people have gotten quality, affordable health care through the A.C.A. And the percentage of people without insurance has been nearly cut in half.
I'm not a huge fan of some very specific things about the Affordable Care Act. And the number one would be the limitations on expansion of physician-owned hospitals.
Did you know physicians aren't allowed to own hospitals? This was part of the Affordable Care Act.
If you're going to let UnitedHealthcare own hospitals, if you're going to let private equity own hospitals, why don't you let physicians own hospitals?
I'm not all about making money Like I'm the least wealthy plastic surgeon you will ever meet. I take everything, Medicare, Medicaid. I do surgery for free. I am in this for the karma, and that my karma bank is full, right? So I am a huge fan of expanding access, but I also want to be free to be my best. And I don't like it when the government tells a physician, you can't own a hospital. That's like telling a baker they can't own a bakery. You think that I'm going to cherry pick patients. No, I'm a doctor. Trust me to doctor well.
Well, the physician-owned hospital issue is, it's obviously one that's very important to you, but a relatively sort of small issue in health policy. But I would just say I think that much of the reasoning sort of underlying that, and I'm not sure it was good, and it looks like the new administration wants to sort of change things in that regard. But they were worried about physicians taking the cases that make a lot of money out to those centers and leaving the hospitals basically impoverished. But putting that aside, I was very impressed by what you said. You know, the Affordable Care Act is usually associated with expansion of Medicaid.
The Affordable Health Care Act expanded Medicaid to cover additional 20 million people.
And creation of the exchange insurance markets.
These exchanges will be a marketplace where individuals, families, and small businesses can purchase health insurance.
Both of which greatly expanded access to health care. And that, I think we can agree, is a wonderful thing. But what you said about pre-existing condition, that was a critical change. And it crystallized sort of what I thought was an enduring change in the way in which Americans looked at things, that you shouldn't be able to deny care. And insurance companies could for many, many years. You could deny an insurance policy for somebody who had a pre-existing condition. And the A.C.A. wiped all of that out. And I thought that was like evidence that our healthcare system was finally becoming a really sort of humane thing. So I'm greatly sort of saddened to sort of see the changes that are occurring right now.
President Donald Trump officially signed the controversial One Big Beautiful Bill Act.
More than 5 million Americans could lose Medicaid because of newly passed work requirements.
Tens of millions in the United States will see their health insurance costs soar, pricing many out of health care coverage entirely.
We were improving access, and it was crystallized by this, let's get rid of the pre-existing condition clause. And now I see us sort of turning backwards. One easy fix to improve the healthcare system would be?
Point of care pricing. Again, with the market, I want us to know what we're spending and what on. When you go to the doctor, I want to know exactly what this costs, what I'm paying, period, so that I can shop.
I was going to say transparency because you had raised that before, and it should be an easy fix, right? It should be the kind of thing where the government can insist, as they have, that everyone sort of make their prices known, and that's going to inform individuals. I mean, most people have no good idea about how much healthcare costs. I do some writing about cancer and cancer drugs. And, the administration is now talking about, we'll give everybody $1,500 in an HSA and
put extra money straight into the healthcare savings account. You go out and buy your own healthcare. Let the money go directly to the people where they can buy their own healthcare.
An average person who has multiple myeloma is on 2 or 3 drugs, each of which costs over $200,000 a year. So they just have no sense about sort of what the costs are associated with our healthcare system. And I think transparency, like you said, point of care pricing would be a great thing. And I think that most people in the insurance industry would agree with you on that one.
Awesome. Oh, okay. Over the course of this conversation, I have changed my mind about.
I always struggle with physician complaints about what insurance companies do, simply because, in a lot of circumstances, I think the physicians are used to doing these things and they want to do these things, and they're not willing to sort of listen to the insurance companies outline that this is not part of the sort of standard of care and this is an unnecessary cost. So, I tend to think, because my last 15 years in work were in insurance companies, that the insurance companies are trying to be reasonable, but the doctors just aren't. But then to meet somebody like you, who's obviously sort of a very reasonable person and someone who's clearly and sort of transparently committed to her patients, it makes me sort of reconsider some of the issues, some of the more sort of policy issues surrounding these kinds of things that insurance companies do, like prior authorization. So I really appreciate that.
Thank you. I think likewise, sitting across the table from someone on the insurance side, if you will, to hear that there are humans on the other side trying to reach the same goal, that gives me hope, right? So I'd say if there was a part of me walking into this conversation that was feeling very tired and like, are we going to get somewhere positive? Are we going to change healthcare? Then that part of me is a bit changed. So I appreciate that very much. You definitely, I needed this conversation, and I hope that there are more to come.
Thank you. So did I.